One of the hottest buzz phrases in healthcare today is social determinants of health, or SDH. The World Health Organization defines SDH as the conditions in which people are born, grow, live, and age. And the CDC adds that these conditions affect a wide range of health risks and outcomes. Like most middle-class Americans, I was familiar with the phrase conceptually. But just a few weeks ago, its reality smacked me in the face. Hi, I'm Amy Grant, president of the ABL organization. I needed to get back to my office in Orange County from just west of downtown LA. So I consulted my Waze navigation app, and it determined the most direct and fastest route was to drive across 6th Street from just west of the Harbor Freeway due southeast to the Santa Ana Freeway, near the Citadel. It's only about 4 miles, but in late afternoon traffic, I crept along at sub-teen speeds, so there was plenty of time to see the homeless encampments that stretched on either side of 6th Street for nearly the entire 4 miles. And I was on just one street, in Skid Row. Our recent LA Times op-ed piece entitled "Psychiatric Patients Need Hospital Beds, Not Jail Cells" quoted LA County leaders who often call the jail system the nation's largest mental hospital. It's estimated that 1 in 3 of the county's inmates are diagnosed with mental health disorders, roughly the same percentage as on the street. That means over 5,000 psychiatric patients are incarcerated in LA County Jail alone. And once in jail, if a mentally ill person acts out, their overseers respond with force and isolation, rather than, according to the op-ed piece, care-oriented responses geared toward improving behavior and encouraging recovery, or at least better management of their symptoms. In this photo, taken by Good Samaritan Hospital's CEO Andy Lika, above the tents, the tall building in the background is LA's iconic City Hall, which prompted Andy to reply to the editorial. The answer to dumping thousands of people who should be receiving the proper care in psychiatric hospitals, community-based rehabilitation programs, and supportive housing lie inside these walls, not jail cell walls. The fact is, people are dying on the streets, according to a more recent article in the Times. Last year's LA County homeless death toll was 900, including 5 who died of complications of hypothermia in sunny Southern California. Even for the homeless who aren't suffering from mental illness or substance abuse disorders, living on the streets or in shelters also brings a risk of communicable diseases, such as TB, last year's typhus outbreak in LA, and the hepatitis C outbreak in San Diego, and violence because of crowded living conditions and the lack of privacy or security. As the National Health Care for the Homeless Council states, in many ways, housing itself can be considered a form of health care because it prevents new conditions from developing and existing conditions from worsening. And why are there so many on the streets? One reason is that LA has replaced roughly 10,000 single-room occupancies, the 80 to 120 square foot bath down the hall apartments, which charge monthly rent in the low hundreds, with those that clearly aren't affordable, like the Medici Apartments, the premier resort apartment community in new downtown Los Angeles, where a studio starts at $1,945 a month. According to the LA Homeless Services Authority, LA County's homeless population increased 42% to over 55,000 between 2010 and 2017, with a slight decline in 2018, as median rent in the county increased by 32%, and renters' median income declined by 3%. Most important, of LA's homeless, 75% are considered unsheltered, meaning they're living in cars, tents, and out in the open. In comparison, New York City has about 77,000 homeless, 22,000 more than LA, but only 5% are unsheltered. Why? Because in 1979, the New York State Supreme Court ordered the city and state of New York to provide shelter and board to all homeless men who met the need standard for welfare, or who were homeless by reason of physical, mental, or social dysfunction. And in the 40 years since, it's been expanded several times to include women and children. While the civic hand-wringing goes on in LA County, our neighbors to the north in Santa Clara County are in the throes of purchasing 2 of the 7 hospitals currently owned by Verity Health System, which is now in bankruptcy, to help deal with Silicon Valley's healthcare needs. If the Los Angeles County Board of Supervisors are looking for at least a medical solution to LA's homeless problem, they need look no further than 2 miles away from their offices to see another Verity hospital that's on the block. It was founded in 1869 by the Daughters of Charity of St. Vincent de Paul. According to Wikipedia, when LA County officials recognized the talent of a sister as a nurse, they proposed the idea of them opening an infirmary to promote a better healthcare system in the community. It made St. Vincent's LA's first hospital. Given it's unlikely there will ever be another opportunity as great as the one now presented by Verity's bankruptcy to purchase a 366-bed hospital, so close to so much need for so little, now is the time for LA supervisors to follow their counterparts in Santa Clara County and purchase St. Vincent's. Well, that's my opinion. What's yours?